Hello, everyone. My name is Francine Oliveira. The title of my talk is Prescribing Knowledge, and I'm going to talk a little bit how social media can play a role in public health. And I'm going to talk on as the setting as in Brazil. So a little bit about me. I'm a medical doctor. I'm specialized in pediatrician. I'm a pediatrician in Brazil. I have a lot of experience working in public hospitals, mainly in emergency rooms. So I'm used to a lot of chaos. I actually like to organize the chaos. And I also have some experience as a teacher. In Brazil, our medical school is a little different. We have 6 years curriculum, so we go through some specialties during med schools. So I used to train the students, teaching them PEDS during their medical training. During the pandemic, actually the ER from the kids was empty, but I was seeing a lot of mental health issues in teenagers and the parents. They were overly anxious, overly stressed, and I had kind of a free time. I wasn't socializing, so I decided to study family couples therapy along with other therapists, social workers, and some other fellow doctors. And I started to sharing some content about what I was learning in social media. That's why I picked this topic for this presentation. And this actually, it wasn't my goal, but this actually opened up a lot of doors. And I started being a speaker at some schools, some universities. I started talking to teenagers, parents, families about mental health, about some health issues, about how the pandemic affects us. And my life changed a little bit after the pandemic. I'm currently living in the US, and my goal right now is focus on mental health and become a psychiatrist, and still working with kids and teenagers, but now as a psychiatrist. And of course, since we're talking about social media, I had to put on a really meaningful sentence with a sunset. And the sentence from Castell really hit to me. It says our language are a means of communication. Our means of communication are metaphors, and our metaphors create the content of our culture. So the way we communicate right now is a background from the way we live. So if you're texting, if you're DMing people, this affects the way you live. So to give you a little background how things works in Brazil, we use social media a lot. We WhatsApp, we almost everyone has Facebook or Instagram, and it's not just young people, like grandmas have Facebook, uncles have Facebook. Like if you meet someone about my age and you ask for the Instagram and you're dating and you ask for the Instagram, they don't have it. Oh, this guy is married. You think someone is wrong with them. So it's very common. We are the third largest social media user in the world. So it's very, very common. And the social media we like the most is Instagram, YouTube, Facebook, TikTok, and Twitter. So, and what Brazilians are doing social media nowadays? So surprisingly, since social media was invented so we could talk to people, but I found this study on a company, it's called Hibu, that was actually done in September. It was a research made with about 1,200 people, asking what they were doing on social media. And surprisingly, most of them were saying that they were using it to catch up on the news. They were also using it for entertainment. They said they were doing to help in a social cause. And here's a kind of funny fact: in Brazil, we care a lot about what other people think of us. So if it's a survey, maybe they're talking some stuff to impress some people. And other things too, they are also saying that they use it to learn and to teach. So there is a lot of opportunity here to talk about health on social media. And another interesting topic, when it's very common when we see in social media, I bet that's not only in Brazil, a lot of company, a lot of people use social media for business. They create professional content the same way I was doing when I started. And they ask for these people what kind of content they like the most. If you ever tried Brazilian food, you must understand why most people say that it was gastronomy, the content they like to see the most on social media. And they also said it was humor. They also like to see a lot of content about TV shows and movie. And they also actually really like to see informative content, a lot of content about education. And it's also very common to see in social media that we see a lot of informative content in a way of entertainment. We make the content a little lighter with jokes, maybe in a more theatrical way. That's very common here. And I chose a study made in Brazil during the pandemic with actually numbers to highlight how social media can play a role in public health. So I chose this study to have some numbers to show you guys how important this is. So to give you guys a little context, what was going on in Brazil during the pandemic years, there was a lot of political tension. Things were highly polarized, and there was an increase of the hesitation about vaccines, despite Brazil having a really solid vaccination program. There was this hesitation going on during the pandemic. There was an intense public debate happening about if we should use masks, everyone should use masks, or if it should be reserved for health professionals, how social isolation was going to affect the economy. People are going to die from COVID, or people are going to die from poverty if we just shut down all the commerce. And to remind you all, Brazil is a very unequal country. And to exemplify that was there were some people telling how homeless people were very confused about what was going on. They were seeing commerce being shut down. There was no traffic, people wearing masks on the street. And this highlights a little bit about how even information can be a privilege. And in this study, they analyzed especially the word vaccine on Facebook and Instagram. And they also analyzed the timeline of this word. They noticed that the debate about COVID vaccines increased on social media, especially on March 2021. That was when the human trials started. And the most cited vaccine on social media was CoronaVac. It was the vaccine that was produced in Brazil. And here I displayed this table to show you the numbers. So on Instagram, I'm gonna show you the huge numbers. So the number of likes on 2 years. I'm not sure if I even can say this number in Portuguese. It posts talking about vaccines, almost 1 million on Instagram, on Facebook, 3 millions. So there were a lot of likes, posts, a lot of comments just about vaccines. And I'm not even in the studies, they didn't even analyze COVID or other related topics about the pandemic, just about vaccines. And here I would like to talk a little bit about who was talking about these topics. To exemplify a little bit about the political side, two main characters. The first one was the current president of Brazil. I don't know if you remember this or if you were following it. The president was actually trying to convince people not to get vaccinated, and he was having a lot of reach. He was having a lot of support from a lot of people. He had over 1 million comments on his posts. And in third place here, this governor from São Paulo, he was supporting a lot the coronavac vaccine. He was trying to support people to use masks, get vaccinated. So he was on the opposite side of the president. And you can see how close they were about the number of comments. So it was highly polarized, and at the same time, they were very close. And the second place here is a newspaper. The media also was very advertising everything, just like all around the world. Also, the numbers very close. Here, it's a chart that I made mostly to highlight who were the main agents talking about vaccines on Instagram. You can see that media was mostly half of the profiles talking about vaccines. Politicians occupied mostly 20%. Celebrities were a big chunk, and health profiles and other health organizations were just this small chunk. Just this small here, the blue and the yellow. And here I'm gonna highlight this character, this lady from Brazil. Her name is Juliette. She had only 9 posts, and she managed to have 15 million likes talking about vaccines. I'm gonna give you a time to think about who she is, what she did. Maybe she discovered a technology about a vaccine. Why she had so much attention talking about vaccines. In the meantime, I'm gonna show you how the Minister of Health plays in all of this. They really tried. They made over 1,000 posts, but only this amount of comments. In the meantime, the institute that actually created the vaccine was producing a lot of posts, almost 1,000 posts, had this amount of comments. And now I'm gonna tell you who was that lady. She was actually a reality TV winner. She became a celebrity in Brazil, and she is pursuing a singer career now. She became a digital influencer. Luckily, she was trying to convince people to get vaccinated. So she was trying to get people to get the vaccine, but she doesn't have any health background or any science background. And here's just to show you guys that on Facebook, it was actually very similar on Instagram, but I don't know if you ever saw this information, how Facebook is heavily used by politics, and it's even more than Instagram, is this big orange side here, politicians talking about vaccines. The media was also heavily present here on blue, and research institutions, mostly about health, is just this yellow side here. So why I decided to share this topic with you guys? We can see that how complex social media can is, and how this environment can impact public opinion on several scientific topics. It's a really challenge nowadays how misinformation and fake news can spread, not only on social media, but mainly. And despite all that, we can see through those charts that I showed on the beginning of the presentation, that is actually a huge potential for health promotion, and use it to show a lot of information about health. And maybe we can even partner out with governments and to have profiles to spread information that we can actually trust. And maybe we can also have the celebrities and use their voices to disseminate quality health information. So we can combine our voices and use those platforms to spread information. If you ever want to make sure science doesn't stay only in our academic walls and decide to share information on social media, I have some tips here. Make sure you know your audience, make sure you know who you're talking to, use simple language, try to make the subject as simple as possible, use a lot of image, a lot of charts, make sure, like that's very common in Brazil, we do it a lot, we are a little more casual. So we can try to share some personal stories to make, we're all humans after all, we work on connections, try to use some personal stories to give a background. Make sure the crowd is engaged, is participating. It's really good to keep it very updated, maybe talk about something that's going on, something that's on the news, become a myth buster, talk about maybe how we're not gonna get a cold if you go out in the rain, maybe that grandma's gonna be upset about you talking about that, but maybe she might take the grandson to play in the rain, you never know. You can diversify the format, maybe it can be a post, a video, a reels, invite colleagues, maybe you can do an interview, a chat, who knows. And you can also answer frequent questions. Maybe if you're having a lot of questions on DMs about the same topic, you can answer in a video, you can answer in the stories, you can make sure this information, if it has been asked a lot, maybe a lot of people has the same issue, so you can talk about that. Those are my references for this presentation. And I would like to know how social media has been used in our country. So if you want to share, it's really easy to find me on social media. It's just my name. I'm on LinkedIn, Instagram, Facebook. So thank you so much for this opportunity. If anyone wants